السلام عليكم جميعا. أول شيء شكرا لل Emergency Medicine Interest Group على التنظيم وعلى شغلهم الرائع. I'd like to welcome my colleagues and friends الدكتور عبد العزيز المحلسي، الدكتور عبد العزيز الشيخ، الدكتور محمد العقيل والدكتور فواز التويجري، وأظن الدكتور بدر اليحيى يحتاج كم دقيقة لأنه بيخلص الشفت وبيجي. Today we'll talk about emergency medicine residencies and fellowships outside Saudi. The talk today will be focused on these two subjects only: residency and emergency medicine خارج السعودية، والفellowship تابع للemergency medicine خارج السعودية. We'll go along in the sequence that the interest group has provided us with the slideshow, and we'll take it from there. If you have any questions at any point in time that are not answered directly, please write them in the chat and we'll get to them at some point. شكرا. أول موضوع أتوقع بيصير مديرها الدكتور عبد العزيز المحلسي اللي هو Residency in Emergency Medicine في اليو اس. We'll go through the application process, the differences between the emergency medicine program in Saudi Arabia and in the US, and then he'll describe his experience to us in the residency in the US. تفضل دكتور عبد العزيز.
السلام عليكم جميعا. شكرا دكتور فهد على الاستضافة، وشكرا للإمرجنسي ميديسن انترست جروب على الاستضافة. It's my pleasure to be with you guys. طيب، الابليكيشن بروسيس اليو اس residency programs كلها قبل before you apply عشان تقدم على الريزيدنسيز، الشرط اللي موجود اللي هو انه you have to be an ECFMG certified، واللي هي اختصار Educational Commission for Foreign Medical Graduates. فالفكرة من ال ECFMG إنهم يعطونك السيرتيفيكت إنه أنت you graduated from medicals or you have credentials موازية للgraduates حقين أمريكا. And the way to get to the ECMG certification, you have to pass the United States Medical License exams. طيب، فاليو اس ام الليز في عندنا ستيب 1 وستيب 2. ستيب 2 فيها سي كي اللي هو الكلينيكال نوليدج، وفيها الكلينيكال سكيلز. طبعا الكلينيكال سكيلز للسنه هذه حسب ما انا اعرف انه ما هو ريكوايرمنت بسبب كوفيد، فصار اللي هو الكلينيكال نوليدج والستيب 1. الكلينيكال سكيلز ما أعرف صراحة، ما عندي enough information إذا هي حترجع مرة ثانية ولا لا. طبعا ستيب 1 كان سابقا graded two ways، يكون في grade اللي هو من 3 أرقام اللي هو الدرجة توصل إلى 270، وبعدين في البرسنتايل، وطبعا باس ولا فيل. هذه تغيرت recently اللي صار باس وفيل exam, which makes it easier for a lot of people to apply، لأنه كان ال grading system شوي يخلي فيه cut offs معينة أن الواحد لازم يعديها. طبعا في تاريخ معين أنهم they will switch to the pass and fail to get more information about the time إنه متى بيصير pass and fail بدال انه اللي هو جريد او الدايركتور الاي سي اللي اليو اس ام اللي ويب سايت. طيب، عشان تحصل الاي سي اف ام جي certificate you have to pass step 1 step 2 CK step 2 CS. طبعا كافيات انه الاتمتس مسجله لكل الستبس هذه. فانت if you took the step 1 let's say you failed, this will be recorded. فلما تقدم مرة ثانية they will know أنه you failed one step. And unfortunately بسبب أنه الإقبال الكبير على الريزيدنسيز في أمريكا من كل العالم، ولأنه الابليكنتس عددهم كثير جدا، يخلي أنه تقريبا أي واحد بالذات الإمرجنسي ميديسن if they don't pass one of their steps بيخلي قبول بالنسبة لهم صعب جدا. فعشان كذا انه if you're going to take the exam you have to be sure and you'll be able to pass it. And there are ways to make sure and you'll be able to pass it ولا لا. منها اختبارات تجريبية في ال MBME اللي هو National Board of Medical Examiners. فيها يعطونك زي الاختبارات تجريبية لل USMLE, which is very reflective. Sometimes it's even reflective within 5 points, or sometimes it's reflective within 10 points. طيب ال US programs differ from the local programs. السؤال هذا جدا جدا صعب. in general الريزيدنسيز خارج المملكة تعطيك experience إنه you experience a different healthcare system. طيب الكتب والكنولج حيكون واحد. الكنولج في السعودية نفس الكنولج في أمريكا نفس الشيء. طيب بس بيكون في أشياء pathologies معينة social aspects البيشنتس تكون خاصة في أمريكا أكثر من السعودية. ممكن ما تشوفها as common في السعودية. على سبيل المثال مثلا اللي هو الفايلنس الجن فايلنس في السعودية ما هو common زي ما هو common في أمريكا. ففي أمريكا في أي residency program you'll be expected to see a lot of gunshot wounds, stab wounds, اللي هي penetrating trauma. عندنا في السعودية مثلا you'll see way more blunt trauma بالذات من road traffic accident, medical vehicle collisions. الريزيدنسيز خارج السعودية في أمريكا في ستيتس لها خبرة طويلة في التريننج. الامرجنسي ميديسن ريزيدنسيز في أمريكا بدأت في عام 1970 بينما عندنا احنا في السعودية تقريبا بدأت في 2000. ففي experience أكثر من عندنا من ناحية كتايم. طيب الانوفيشن in education في أمريكا يمكن they're reaching new levels فيها بحيث إنه involving open access medical education, flipped classroom, طرق تدريس جديدة مختلفة موجود عندنا عندنا في السعودية. لكن يمكن هناك يكونون they have more experience and they've been doing it for a little bit of time. طبعا الريزيدنسيز هناك مرة مرتبة pathways واضح. الإكزامز هناك في أمريكا it's a one time exam. يعني هنا في السعودية residency they have to go through an exam every year. عندهم اللي هو البارت 1 والبارت 2 اللي هو الفاينل وعندهم البروموشن exams. ف you have to go through a lot of exams. في أمريكا you have only one exam. تخلص الريزيدنسي you're board eligible تقدر تشتغل في أمريكا وبعدين تقدر تاخذ one exam and you'll be board certified. شيء ثاني طبعا التكست بوكس اللي يستخدمونها أمريكا هي نفس التكست بوكس اللي تستخدم في السعودية كلها روزنز اند تنتنالي نفس الشيء. فالنولج سورس تقريبا واحد. في فوكس كثير على الريسيرش في أمريكا على الكواليتي امبروفمنت على البيشنت اكسبيرينس. أشياء هذه فيها فوكس عالي في أمريكا هناك. يعني if you go through almost all programs في أمريكا you'll be able to do a research project, be involved in research, be involved in medical education, quality improvement. فهذه الأشياء موجودة هناك وتسيت أب. يعني ما هي مو لازم إنك تروح تدور منتور فيها. يعني في أشياء واضحة إنه عندهم research projects واضحة يعلنون عنها it's going وماشية. if you want to start your own research تقدر تقدمها للريسيرش كوميتي ولا الريسيرش جروب they help you out. في هناك طبعا الريسيرش اوفيس they will provide كل department عندهم research assistants they will help you out with gathering data and starting your own research. فالريسيرش هناك is easier to get through. هنا عندنا شوي حنا we're not الريسيرش عندنا ما هو متبلور كويس وmature enough ما اغلب الديبارتمنتس ما عندها ريسيرش، يعني بعض الديبارتمنتس عندها ريسيرش اسيستنت وغيره، بس مو كل الديبارتمنتس عندها. ما في سبورت حق الريسيرش نفس الليفل اللي في امريكا. اتوقع هذه الديفرنسز. وما اذا في اي اسئله specific questions انا ممكن اجاوبها على specific things اللي في مثلا residency في السعوديه مقابل امريكا. I'll be happy to answer. بالنسبه my experience, I'm extremely happy with my experience. I think it was a great decision. It was a good decision. If I have to do it again, I will do the same thing. أنا كان عندي كنت أنا initially planning to go through a Saudi program, بس بعدين غيرت رأيي to go to North America. I eventually ended up going to the US. It was a good experience. الناس هناك very inclusive، يعني ما تحس إنك غريب. You'll be able, if you want to be يعني involved in education, involved in teaching, be a chief one day. كل الأشياء هذه you can do it هناك. يعني ما في إنه هذا سعودي ما يصلح يصير chief، ولا ما تقدر teach students، ولا يصير عندك be involved in emergency medicine interest group. لا، it's very inclusive يعني. فما حسيت بالفرق إني في فرق بيني وبينهم. طبعا الريزيدنسيز هناك is paid. They have to pay you. So they pay you تقريبا سنويا، يعتمد على المدينة على الريزيدنسي، لكن تقريبا ballpark they pay you as an R1 أو PGY1 تقريبا $50,000 سنويا بدون التاكسز، يعني يسحبون منها التاكسز. فيطلع تقريبا 2,800 إلى $3,500 بالشهر. وهذا الرقم يتزايد على كل سنة. ف they have to pay you. غير اللي يجيك إذا أنت مبتعث من الملحقية ولا من أي جهة تعليمية هنا تأخذ $1,890. ف financially it's good. حتعيش مرتاح، يعني ما حتحتاج إنه يعني هناك في financial support من نفس الانستتيوشن. طبعا يجيك medical insurance من نفس الانستتيوشن، لازم يعطونك medical insurance. وغير الانشورنس اللي يجيك من السعوديه. ففي ناحيه finances it's good, it's not bad يعني، وما هي بهارد.
يعطيك الف عافيه دكتور عبد العزيز. I have a few questions that I would like you to clarify first قبل ما ندخل أسئلة الستودنتس. السؤال الأول how is the residency length different in different programs according to the university. السؤال الثاني which relates to it, there are things that are being said that it depends, يعني the quality of the program depends on what university you go to or what program you join في US. Can you elaborate on both these points please?
طيب خليني بتكلم عن السؤال الأول. السؤال الأول اللي هو اللينكس. طبعا الريزيدنسيز في أمريكا، الامرجنسي ميديسن ريزيدنسي في أمريكا it can be either 3 years أو 4 years. طيب 3 years أغلب الريزيدنسي في أمريكا هي 3 سنوات، وهذا الكلاسيكال كانوا 3 سنوات من زمان. في بعض السنترز من زمان هم 4 years. والسنترز ال 4 years قليلة، يعني تنعد على الأصابع، اللي هم جورج جي دبليو اللي أنا رحت لها، في عندك هوبكنز، هارفارد، UCLA، USC، وهذه اللي أنا أتذكرها صراحة. هذول 5 programs. يمكن في أتوقع في زيادة 3 4 أو 5. وهذه موجودة إذا رحتوا الأمرة في عندهم زي البوكلت يتكلم عن كل الريزيدنسيز. طيب واللينك حقها والبروجرامز بروجرام دايركتورز. طبعا الريزيدنسيز في أمريكا في عندك two pathways. في academic centers وفي community based أو او county base. طبعا الثوت اللي عند الناس كثير انه الاكاديميك سنترز اللي هي يونيفرسيتي انها هي اللي لازم تكون احسن يعني من الكوميونتي, which is not completely true. Generally yes, الاكاديميك سنترز تكون stronger programs, لكن في بروجرامات في امريكا من التوب بروجرامات من community hospitals. مثال عليها اللي هي كاروليناز مثلا, هذا community center. طيب لكنه it's probably one of the best residencies في امريكا. طيب LA County it's a university affiliated, لكن البراكتس كله في a county hospital اللي هو مستشفى مملوك من الحكومة. طيب بالعكس الكوميونتي هوسبيتالز تعطيك اكسبوجر على اشياء كثيره اليونيفرسيتي ما تعطيك اياها, ونفس الشيء يونيفرسيتي هوسبيتال تعطيك اكسبوجر على اشياء كثيره الكوميونتي ما يعطيك. بس جنرالي اغلب الريزيدنسيز يعطيك both experience, لانه كلهم affiliated مع community hospitals. مثلا الريزيدنسي اللي انا فيها كان 25% of my training in a community setting. كنا نسوي الريزيدنسي كلها في جورج واشنطن يونيفرسيتي هوسبيتال, هذا كان البيس حقنا, لكن كنا نروح الاينوفا فيرفاكس which is a community hospital نسوي فيها 25% تقريبا و20% من اول ريزيدنسي. كل الريزيدنسيز في امريكا يس في differences, يعني امريكا لانه الريزيدنسيز حقتها كثيره مره ومتوسعه, ففي variation بين الريزيدنسيز, حتى في variation بين الروتيشن. يعني مثلا الريزيدنسي حقتي انا اللي كنت في جورج واشنطن كان ما فيها انترنال ميديسن روتيشن. بعدنا كم بلوك في جورج تاون كان عندهم انترنال ميديسن روتيشن. احنا كنا 4 years هم كانوا 3 years. طيب لكن كل ريزيدنسي لها نقاط قوه ونقاط ضعف. طيب لكن ان جنرال كل الريزيدنسي في امريكا راح تطلعك a safe physician who can go and be a safe emergency physician. كلها will prepare you to pass the board exam. فأتوقع أنه هذا السؤال يعني don't put a lot of weight on it, لا, don't worry about it. Any residency you'll go to it will be good. وبعدين بعد ما تخلص الريزيدنسي will open up الفيلوشيبس بالنسبة لك. والفيلوشيبس إذا أنت حسيت أنه عندك مثلا something that you want to learn more about, you can go and do a fellowship an extra year ولا 2 years, it will help you out. اغلب الريزيدنسيز اللي السعوديه مسويه افليشن معاها كلها very good residencies. السعوديه مسويه افليشن مع جي دبليو, مسويه افليشن مع سنترال ميشيغان يونيفرسيتي, مع يونيفرسيتي ماريلاند, مع بيلر كولج اوف ميديسن, والخامسه مع إمري. هذه الخمسه سنترز كلها excellent programs, كلها some of the top programs في أمريكا. فإذا أنت بتروح through الأفليشن you'll be good, don't worry about it. اللي ممكن يواجهك إنه لما تقدم على الماتش, طبعا الماتش كلها حتقدم على الماتش, بس في positions في الخمسة universities هذه خاصة بالسعوديين, ما حد يقدر يقدم عليها غير السعوديين. لكن لو لنفترض مثلا إنه أنت ما قدرت تجيب sponsorship, عادي تقدر تقدم على أمريكا تقريبا مختلفة عن مثلا كندا, ويمكن أنا ما أدري عن أستراليا, لكن عن كندا إنه كندا ما تقدر تروح إلا وأنت عندك sponsorship. طيب لازم تكون مبتعث من السعودية. أمريكا you can apply directly and they will sponsor you, زي ما صار معي أنا في الفيلوشيب ما كانت sponsored بالسعودية, كانت sponsored by اليونيفرسيتي اللي أنا سويت فيها الفيلوشيب, يعني sponsored and paid for by the US, مو by السعودية. فأنتم كلكم كان apply للماتش كامل, you apply مع الأمريكان and you compete with the Americans on the spots. طيب وش السؤال الثاني فهد؟
لحظة. السؤال عبد العزيز, is there a difference between the emergency and other specialties in the application process?
Between emergency and the other specialties
and the application process.
طبعا when you apply انت تروح you apply to the match system. طيب الماتش الريزيدنسي match system انت تحدد what you apply for. طيب تقدر تقدم اذا بغيت، يعني اذا انت مثلا محتار بين internal medicine وemergency medicine، ولا انت خايف انه مثلا you don't match في الemergency، you can apply emergency, internal medicine, surgery, you can apply to whatever residency you want. طبعا الابلكيشن، المشكله في الابلكيشن انه كل ابلكيشن ترسله عليه مبلغ، والله ناسي كم المبلغ، لكن كان في برضه موجود في الماتش ويب سايت يقول لك اذا انت you apply for 10 residencies من 0 to 10 يكون كل ابلكيشن سعر، بعدين الى 50 سعر ثاني، الى 100 سعر، الى 200 سعر. يعني ممكن انا مثلا ابلكيشن انا دفعت عليها تقريبا، اذا ماني غلطان تقريبا دفعت على البروسس حدود ال $3000 ولا $2000. فالابلكيشن غالي، فكل ابلكيشن تزيده ترسله، لان ابلكيشن ترسل للريزيدنسيز طبعا through اونلاين، كلها اونلاين ابلكيشن، بس انه you have to pay them for every single application. فيبغى لك تحسبها، يعني تقدر تقدم على كل الريزيدنسيز اللي في الامرجنسي، تقدم على انترنال ميديسن كامل والسيرجري كامل، بس في الاخير تطلع لك انك دافع لك $10,000. فيبي لك تحسبها. وكل الانفورميشن هذه موجوده على الماتش. فما في ذاك الديفرنس. طبعا انت لما تقدم مطلوب منك required انك تقدم sealed letter of recommendations. السيلد letter of recommendation يرسل لينك للفيزيشن اللي بيكتب لك الريكومنديشن. طيب وانت ما تشوفها ترفع بالسيستم. طيب وبعدين لما انت تقدم على الريزيدنس، اللي نفترض انت بتقدم مثلا انت خايف انك مثلا ما you don't match an emergency medicine، تبغى باك اب بلان انك apply for internal medicine، السبوتس حقت internal medicine اكبر واكثر واقل competitive. طيب فتقدر ترفع انت 6 letters of recommendation. اذا جيت تقدم على الامرجنسي تختار انت وش الريكومنديشن اللي ترسل لهم، فترسل لهم الريكومنديشن حقت الامرجنسي. قدمت على internal medicine ترسل لهم الريكومنديشن حقت internal medicine. So you can choose وش الريكومنديشن اللي ترسل لكل بروجرام. فالابلكيشن هو واحد، بس انه عندك انت مساحه انك وش ترسل وش تسوي how many programs، ما في limitation يعني، بس كل شيء بفلوس يعني you have to pay for it.
ممتاز، يعطيك الف عافيه عبد العزيز، شرح وافي وكافي. Do we have any questions about residencies in the US before we move on?
Dr. Abdulaziz, I would like to ask you and the rest of the doctors إنه كم البروسس هذه حقت الابليكيشن كلها تاخذ وقت؟ يعني أنا متى أقدر أقل وقت أقرر فيه إني أبغى أطلع أكمل ريزيدنسي برا وأجهز الاختبارات وكل شيء؟
طيب طبعا في if you look up online ممكن تكتبون مثلا residency application timeline، حيطلع لك بالذات في إذا تبغون في ويب سايت اسمه studentdoctor.com I think. student doctor هو بلوج الميديكال ستودنتس يتكلمون فيه عن الابلكيشن، بس you have to create account ببلاش. create an account واقروا وش قاعدين يقولونهم، لأن هم more updated than me. أنا من زمان مقدم. طيب يحطوا لك تايم لاين. زين، عادة التايم لاين ترى قبل الماتش داي يكون في مارش من نفس السنة اللي أنتي تقدمين عليها للريزيدنسي. طيب لكن الابليكيشن بروسس يبدأ عادة، لأنه أول شيء لازم you have to buy a token، شيء اسمه token في NBME. التوكن هذا you get it and then you apply تروحين للماتش. فإذا أنا ماني بغلطان بس double check في student doctor ولا online، الابليكيشن يفتح في سبتمبر. في جولاي you can start filling up your application. في سبتمبر اللي هي السنة اللي قبلها ترسل الابليكيشن، تقدرين تبدين ترسلين الابليكيشن. طبعا ما ينفع الأغلب الانترفيوز ترسل في البداية. فالناس اللي تقدم متأخر، يعني قدمتي مثلا بدل ما قدمتي في سبتمبر قدمتي في نوفمبر، the chance that you'll get an interview is almost zero. very little chance إنه يجيك interview. ليش؟ لأنه هم they review يبدون they review الابلكيشن and they after reviewing the application they send out الانترفيوز على تقريبا اكتوبر اذا ماني بغلطان، بس بليز دبل تشيك التايمينج لان ممكن تكون تغيرت، ممكن وقتي انا كان مختلف، فدبل تشيك التايمينج. طيب طبعا هذا الابلكيشن بس. نرجع نجي للاكزامز. الاكزامز اليو اس ام اللي ستيب 1 it takes a long time to master لانه it's a really difficult exam. اليو اس ام اللي ستيب 1 يختبرك في كل البيسك ساينسز. ف you have to prepare and you have to pass a step 1. You have to pass a step 2 CK وpass a step 2 CS. طيب عادة البريبريشن حق الستيب 1 إذا بنتكلم عن الأمريكانز اللي هم وهم قاعدين يدرسون البيسك ساينسز يروحون يختبرون ستيب 1 their preparation takes about 6 to 8 weeks عادة. بس هذول الأمريكان. حنا if you already finished your basic sciences and you just start reading about it or want to take the exam على سنة خامس أو سنة سادس, it might take you longer. Usually it takes about 6 months to a year and a half. يعتمد على الشخص how much time and effort you're going to put down. طيب step 1 should be the first thing to get out of the way لأنه هو أصعب شيء وهو المعضلة الكبيرة اللي تخلي الناس ما تقدم على أمريكا. So if you have to prepare and you have to start thinking about step 1 at least أنا رأيي at least 2 years before you apply before your target time. فإذا target time إنك أنت مثلا تدخلين في 2024 مثلا, you should have the step 1 results in my opinion at least 2022. طيب ليش؟ لأنه عندك step 2 CS و step 2 CK. step 2 CS easy, very easy exam. في courses if you want to take them and I recommend taking them. It's a 5-day course في مثلا Kaplan ولا غيره. Or you can prepare with someone else. Usually it doesn't take a lot of time to study it. ويعتمد عليك طبعا. يعتمد على الشخص لكن it usually take about 2 weeks to prepare for it إلى 1 month بالكثير. طيب step 2 CK نفس الشيء. It's an easy exam. It's a clinical exam. فشوي إذا أنت على نهاية سنواتك في medical school ولا تخرجت من medical school بيكون مرة سهل عليك. ليش؟ لأنه أنت already هذا all of this fresh. فكلها clinical knowledge. فهذه عادة take 1 to 2 months بس برضو يعتمد على الشخص. في ناس أنا أعرفهم خلصوا step 1 في 3 شهور. في ناس أعرفهم خلصوا step 1 في 2 سنين. فيعتمد على الشخص. بس أنا أنصح الناس مثلا إذا كان معنا من الناس اللي موجودين الحين من students هم في they're doing their basic sciences, start preparing for step 1 as early as possible. ليش؟ لأن it's a lot of reading and it's a difficult exam. It's a really difficult exam but it's very doable. A lot of people passed it وسهل الموضوع. you have to start preparing early. نتكلم عن 2 years at least. وطبعا لما تقدمين على residency you have to understand your letter of recommendations your اللي هي reference letters وكل CV حقك وstatement letter لأنهم لازم letter of اللي هو statement of purpose أو letter of statement اللي هي essay كلها تكون جاهزة في سبتمبر في جولاي من السنة اللي قبلها. يعني إذا أنت بتقدمين على 2024 جولاي 2023 كل شيء لازم يكون جاهز لأن you want to upload it أول ما يفتح and you want to send your application to residencies as early as possible.
Doctor, another question please. Is taking an elective outside and in the United States increases my chance to be accepted?
elective سلاح ذو حدين. Again يعتمد عليك. If you're good and you're going to be committed or you're going to show up early, leave late, be nice, and be enthusiastic or show interest, yes, it will definitely help you a lot. لكن أنا أعرف ناس جو سووا معنا elective and they shoot themselves in the foot. يعني ما their elective is the reason why they did not get accepted. ليش؟ لأنه واحد جاء كان very arrogant وواحد جاء كان مرة ما هو interested ويجي متأخر وبعدين فجأة يختفي من الشفت. فالأشياء هذه إذا كان الشخص is going to do it, if you're not going to be serious about it, لا تسوي elective لأنه you will decrease your chance. بس if you're good, if you worked enough time in emergency medicine, if you're going to show interest, you'll be very interested هناك, very nice to the people, show up early, ما تتأخرين, yes, it will help you out. طبعا هم هناك they look when you do your elective يبون يعرفون أول شيء يبون يتأكدون إنك أنت a good medical student. طيب ما يتوقعون منك إنك تكونين نفس الليفل حق ال R2 ولا R3 لأنه أنت medical student, their goal is to train you. هم يبون أحد يجي they train, so they want someone who's trainable. إنه someone who's trainable يعني واحد يكون interested, they know how to take history, they know how to do physical exam, they're nice, ما هم defensive, they show up early, and someone that they can talk to. فإذا هذا الشخص هو أنت, yes, it will help you a lot. وأنا أنصح if you أنا أنصح إنه قبل ما تروحون تسوون elective, work with someone من الphysicians اللي هنا وشوف خلهم يعطونكم feedback, يعطونكم work in the emergency department, شوفوا patients في ER, حاولوا تحسنون الهيستوري والفيزيكال اكزام حقكم عشان لما تروحون هناك you can be prepared. طيب you'll be prepared زين. وبعدين روحوا سووا electives في الاماكن اللي انتم بتقدمون عليها. مثلا اذا انتم مثلا بتقدمون through السعوديه, try to do an elective في GW في University of Maryland. انا ما ادري اذا هم يسمحون فيها ولا لا, على وقتي كانوا يسمحون في GW انه to come for an elective. It's better to do it as a medical student as part of your rotations. يعني تكون elective من الميديكال سكول, يعني medical school تخاطر الميديكال سكول هناك تروحين as a medical student. ليش؟ لأن هذا يعطيك access. فإذا عندكم أنتم rotation اسمها elective في الميديكال سكول, it's better to go through that. If not, then go as a summer elective. طيب. لكن إذا أنت ما عندك سبونسر ولا تتوقع أنك حتقدرين تحصلين سبونسر, لا تروحون للريزيدنسيز اللي ياخذون سبونسر لأنهم ما راح ياخذونكم. الريزيدنسيز اللي هو عندهم سبونسرز من السعودية ياخذون بس الناس جايين سبونسرز من السعودية حتى لو أنك أنت اكسلنت. هذا عادة اللي يصير. فروح المكان يكون residency is known that they're IMG friendly. يعني روح شوف الريزيدنس اللي عندهم, شوف في أحد متخرج برا أمريكا, أحد متخرج من أوروبا ولا من الصين ولا من الهند ولا من باكستان. إذا عندهم ناس عندهم أكثر من شخص IMG أو عندهم واحد اثنين, then they're IMG friendly. IMG friendly residencies يعني ما عندهم مشكلة يأخذون international medical graduate. بعض الريزيدنسيز للأسف ما يأخذون و they don't even want to bother لأنه it's a risk. طيب فروحوا الأماكن اللي هي good residencies و IMG friendly. وtry if you know someone, if you work with someone who graduated from the US من هنا, and they would want to recommend you and you did well with them, that will help you back. يعني مثلا
especially if they're from the same school.
Exactly. فمثلا يعني إذا مثلا if you're interested in GW, try to work with me. If you're interested in University of Maryland, try to work with Dr. طارق السلامة, Dr. يزيد المالكي, ولا دكتور حسين الهاشم. كل هذول جايين من ماريلاند. في أكثر من شخص, يعني في ناس كثير في السعودية متخرجين من أمريكا. It's all it takes إنه تروحين على alumni list الكير residency and you will know where they are. You will know their name. You just Google them and you find them, and you can go and work with them في السعودية and tell them أنا be frank, يعني أنا أبغى أروح University of Maryland. Do you think they will take me? كيف أقدر أروح? Can you help me? ممكن تعطيني recommendation, ممكن تكلم لي program director. لأنه I think if someone picks up the phone to call the program director, that will increase your chances dramatically. لكن عشان someone will pick up the phone and call the program director, you have to be really good. لأنه صعب إنه to ask someone for a favor if you didn't work with them, ولا they don't trust you, ولا they didn't have enough time to evaluate you. ليش؟ لأن الفون كول هذه might get you a position، لكن إذا if you went there and you were not good، خلاص الفون كول الثانية ما راح تمشي because they will lose trust in that الشخص هذا اللي كلم. فاسم الشخص يعني الفاكولتي اللي بيعطيك recommendation واللي بيكلم لك حيكون على المحك. فعشان كذا ممكن يكون بعضكم get frustrated انه يجي مثلا اشتغل شفت واحد يقول عطني recommendation. انا شخصيا ما اعطي recommendation. ليش؟ لانه I don't know you, I didn't work enough time with you, I didn't work enough shifts, I couldn't evaluate you. فبس عشان كذا try to increase your exposure للناس اللي هم متخرجين من ذيك البروجرامات على اساس if you are able, if you did well and you get a letter of recommendation, that will help you dramatically. أكيد يعني for sure. نفس الشيء يعني أنا مثلا لو أعطي recommendation تروح مثلا عند residency طلع منها دكتور فهد ولا دكتور بدر، ما راح تكون بقوة اللتر اللي تيجي من دكتور فهد ولا دكتور بدر لنفس الريزيدنسي حقتهم.
يعطيك العافية عبد العزيز. We have general questions. I think we'll leave this until the end لأنها we're focused on site specific discussions now. How do I manage to find a sponsor? Is there a preferred sponsor? I can answer this quickly. This depends on your homework. It's not a static situation. It's dynamic. Different hospitals have different jobs, especially for those who they want to sponsor for residencies or fellowships outside. This depends on you and doing your homework. You have to do your research. That's a short answer to that. No, there is no preferred sponsor because if I prefer Malik Khalid Al Jami, other people will prefer Malik Faisal Takhassi, others will prefer يطلعوا من جامعة الملك عبد العزيز بجدة, and depends on your personal preference. So it doesn't there's not a one answer or one size fits all answer to this question. Any advice to medical students who wants to continue residency outside? I think Dr. Abdulaziz already answered this. The sooner you research the requirements for the residency you want to join, and the sooner you get these requirements out of the way successfully, is basically the best way to look at this, from my point of view, at least. I think we've covered the US quite well. Shukran, Dr. Abdulaziz. We can move on for the sake of time to the US again.
Can I just interrupt at one point, just quickly?
Oh, please, go ahead. Yes.
Yeah. For the part of electives outside, so I agree with Dr. Abdulaziz, and I recommend that you do electives, but I would do it in a different hospital that I'm not targeting. Then your chances of actually impressing them is very hard, given that you're coming to a system that you don't understand, the different EMR system. It's really hard to excel or prove yourself. I would go and try in a different, in North American elective, but in a hospital that I'm not planning to apply for. And if it went all well, I was able to get a good recommendations, all well and good. If not, it's not gonna ruin my chances for different hospital. That's my.
I agree with what both of Abdulaziz قالوا. I think that if you want to do an elective rotation in the department that you want to be accepted in, you have to be a superstar. You have to show them that you're amazing. I remember that I wanted to apply to Canada and I wanted to go to do an elective at McGill, and I talked to one of the senior residents there at the time who I knew very well, Minister Dia. He told me the exact same thing we're telling you now. If you come and do an elective, one simple wrong interaction, one time you come in late, even if the excuse is worth it, it still basically plummets your chances of being accepted to the same program. I think it can work against you unless you're super careful and you're basically a superstar. What's difficult to be a superstar when you're coming from one system and going to a new system, learning new things and dealing with new population. But I think you need to consider that extremely carefully before actually doing it. طيب, now we'll move on to
بس كلمة أخيرة على موضوع electives. ممكن في يعني you can try to get an elective في مثلا مكان random, يعني يكون university hospital ومكان random, and try to get as much feedback as possible. طيب, and then you can go للother residencies. To be honest, يعني to be frank صراحة, what they're looking for is someone that is good. يعني يمكن البار شوي higher في كندا, لكن في أمريكا كان what they're looking for is someone لما يجي من السعودية, لأنه they don't know السعودية, they don't know السعوديين. to be خلون كلنا نتفق إنهم دائما if you apply there إنه يجي من السعودية يصير عندهم تخوف إنه الشخص هذا بيكون quote unquote علة. زين, هم يبون شخص, they want someone that they can talk to, someone that speaks English very well, someone who can have be able to talk to the patient and doesn't have big issues with them. طيب, non-judgmental. طيب, male can deal with female physician without any problem, female dealing with male physician, male patient without any problem. هذا الشيء اللي هم يخافون منه, هذا التوجس اللي عندهم من السعودي applicants. طيب, طبعا again you have to be very good. هذا ما فيها كلام, بس إنه من تجربتي الشخصية, الناس اللي سوت elective عندنا وكانوا زي ما قلت لكم إنه أنا ومثلا الكوريزنت اللي كانت معي في ذاك الوقت أكثر من شخص في الأماكن اللي هي take Saudi sponsor, الشانسز حقت الناس اللي سوت elective كانت أعلى بكثير. بس برضو في ناس سوت elective وأنهوا الشانس حقتهم completely. يعني في ناس كانوا نفس الشيء مقدمين معي في الريزيدنسي على positions, their interaction صار معهم bad interaction مع physician ولا مع patient ولا هذا, أنهت الابليكيشن حقتهم. ف this is something that you have to weigh. كانها يعني it's taking chances. يعني I took my chance and I did an elective in University of Maryland and GW and it went well. It did increase my chances to be accepted in both of them.
يعطيك العافية عزوز. طيب, الحين we're going to switch gears and we'll talk about the same process but for Canada. I'll let my colleagues Dr. Abdulaziz Alalshaikh, who did his residency in McGill, Dr. Badr Alyahya, who did his residency in Ottawa, and Dr. Mohammed Alaqeel, who did his residency in McGill, speak about their experiences. And if there are any questions that they don't answer, I'll be more than happy to answer afterwards. So please go ahead, Dr. Abdulaziz.
Assalamu alaikum jami'an. So I'm very happy to be with you and honored and thank you, Dr. Fahad. Thank you for the interest group. So basically, I'll try to be quick and simple. So first of all, the application process. So the application process is going to be through the Saudi Bureau. So السفارة السعودية والملحقية الثقافية. So you have to send all your paper. As Dr. Abdulaziz mentioned, you have to find a sponsor before you apply. They only accept sponsored applicants. Timeline is different every year, so you have to find it. But definitely, زي ما قال, is a 1 year before you're planning. So if you plan to start مثلا next July, so your application should be done قبلها بجولاي 2019. مثلا ميغيل أو different hospital على الuniversity hospital, they have a يعني you apply both. You apply للملحقية or you apply through the university website. So the university website غالبا they have their own deadline for the online application. If you missed the deadline for online application, it means at least 2 years until you يعني 1 year, but then you can apply next year. So 1 year will be lost. طبعا the requirement for Canada, MCCQE Part 1. زي ما قال دكتور فهد. But it used to be a different one. بس الآن ظهر ال MCC QE Part 1 for the application for هذا licensing exam. يعني هذا زي ال USMLE. It's exactly the same as USMLE Step 2 اللي هو CK, the clinical knowledge. So I would study for both and I would do the exam for both, I think. So I think that's through the application process. Interviews is
one thing to add, Abdulaziz, على application process. So زي ما قال الدكتور Abdulaziz, previously the requirement was called MCCEE, Medical Council of Canada Evaluating Exam. This is the requirement for the students coming from outside the US and Canada. هذا على أيامي أنا. على أيامي وأيام الشباب كانت MCCEE. It's the same exact exam as the MCCQE1. Now they've changed the naming. It's now for everyone they're required. حتى ال US والCanadian graduates, they're required to do the MCCQE1 in order to get into residency, which is the equivalent of a Step 2 CK. What they've added for the foreign graduates اللي هم أي أحد برا أمريكا وكندا, they have to do the national something certification. أعرف الشورت فورم حقتها NAC اللي هي NAC. This is a different examination that's added to it. It's a requirement for everyone who did their medical school outside of US and Canada. It's a requirement now to do before applying to Canada. I can't tell you much about this exam because I don't think any of my colleagues can tell you much about this exam because I don't think it started until 2018 or 19, which is after we were all done with our residency. It's a national assessment collaboration examination. This is just an added piece of information. And one important part I want you to know about Canada before I let Abdulaziz and our colleagues go on is that when you're applying to Canada, you're applying to two places only. يعني أنا لما قدمت في 2010 كان University of Ottawa had closed their doors. They weren't accepting any applications. I don't think they've opened any applications from externally funded residents such as Saudis من وقتها. But that same year McMaster opened up. فكان بس McMaster وMcGill. And when we say it's only 2 schools across Canada that are accepting foreign or externally funded residents, that means that you're competing on 2, 3, 4, at best case scenario, 5 positions in Canada for that year. I think this is something that you need to keep in mind before applications. You need to know how many spots there are, how many schools are open, and how many applicants are going to be with you, because it basically changes your chances. Shukran. Go ahead, Abdulaziz.
Thank you, Pat. So the NAC, I guess it's news for me. So thank you for adding this part. Also, I agree, Annie. So the chances is different from year to year. Position is not any consistent every year. So from year to year, your chances may go up or go down. I'll try to answer the next 2 questions quickly, so I give chances to the others, given that a big chunk of us were in Canada. So how does the Canadian program differ from the local program? And I think maybe the biggest thing to me is زي ما قال Abdulaziz. So they have more emergency staff than what we have. And in emergency medicine in Saudi is newer, so it's just still starting. So they have different emergency consultant with different backgrounds, so you can learn different things from each one. Also, I think exposure. So number of patient to number of residents is different there than what we see here. Sometimes you see more exposure, different pathology. How can you describe your experience? I think I loaded to, I guess if times go back, I'll do the same thing that I did. So moving on to maybe باقي الشباب, just to give them.
Yeah, go ahead. We'll just go in the sequence of names I mentioned. Dr. Badr Alyahya, you can go ahead. Since you at least did the residency in Ottawa, which has closed its doors for a number of years now. You can give us your experience there. And if you have any different answers than Abdulaziz to the first two questions, please enlighten us. And then we'll move back to Dr. Mohammed Alaqeel.
Assalamu alaikum. Thank you for giving me this chance. I'm happy to be with you tonight. Actually, I agree to everything you guys have said. Ottawa is no different than the other programs in Canada. I think most programs are very similar. Unfortunately, Ottawa have stopped accepting residents because they have to accept more IMGs, not externally funded residents, because they need people to stay and work in Canada, in Ontario per se, and specifically the region of Ottawa. So in terms of the training, I don't think it's different than McGill. It's almost the same. The only advantage I would say is the same as Abdulaziz said. It's well-developed program. It's been there for a long time. They have a lot of qualified emergency physicians to teach and to run the program. That's it. I'm not aware of any change to the situation in Ottawa. So it's still the same. They do allow the clinical fellowship, but as far as I know, there is no residency spots for funded residents. I am happy to answer questions, but at this moment, honestly, I don't have anything to add to what the guys have said.
Excellent. Thank you very much, Dr. Badr. Just explain to the students what IMGs are. I'll explain this. So IMGs are Canadian nationals who did their medical school outside of Canada or the US. The way they accept them is that they go through the CARMS process, which is the matching process that they have for each specialty. And then if they match to they have specific spots, which is less than the normal number. Let's say يعني مثلا في مكماستر كان في السنة الواحدة ياخذون 5 CMG residents اللي هم Canadian medical graduates أو American medical graduates. ياخذون 5 أو 6. They'll have 2 spots for IMGs. This is funded by the government of Ontario. They fund these 2 residents for the duration of their residency. And then afterwards, what they do is that they have to give return of service to the government of Ontario, paid طبعا, but they have to actually give their expertise after learning على حساب الحكومة حقت المقاطعة. They have to give return of service for the same number of years that they were sponsored, which is 5 years. But typically, after 3 years, they let them go and let them be freelancers. But once an IMG gets accepted to a province, they have to stick within the province for at least 3 years after the residency, working in one of the hospitals. Typically, they have to be community hospitals, because that's where they have deficiency in emergency physicians. Another important thing that we should mention before moving on to Dr. Mohammed Alaqeel with his experience is that the Canadian program is 5 years in emergency medicine. So it's one of the longest programs until Dr. Fawaz speaks to you about his experience. It's 5 years, but it has a lot of flexibility, and it has a huge number of elective rotations, and you can do your fellowship within the residency depending on how long the fellowship actually is, and we'll get to that later on when we talk about fellowships in Canada. But that's a major difference that you need to keep in mind. It's 5 years. Another good thing about, which I see personally as a good thing, and Dr. Badr mentioned this, is that there's very little variance in the quality of programs between the Canadian schools, because one, compared to the US, it has a less number of schools, and they're all very strictly monitored by the Royal College of Physicians and Surgeons. The variation between schools is very low. Just another thing to keep in mind. Dr. Mohammed, go ahead. دكتور محمد العقيل موجود. He may have left. لا محمد العقيل موجود. Let's give him a few seconds. I'll talk about my experience. So in my year, to give you an example of how limited the number of seats are, there were 2 people accepted in McGill, and I was the only one accepted in McMaster. And it was after a number of years that McMaster was closed. So it felt good. I was extremely lucky, and I started within a program that was well exposed to externally funded residents. We have a good number of emergency physicians that graduated from McMaster in Saudi. It's a 5-year program. I mean, the experience was excellent. I had a few difficulties in the beginning, but I won't get into the details of that. But even with those difficulties, I think I made the right choice in joining the program. And I think the amount that I've learned from that residency program was great. And yeah, I had a blast. Hala.
I'm here, by the way. Sorry about that. I was having some
okay, yeah, no worries. No worries. I'll just go quickly through my answers, and then you can go ahead. Application process, I won't get, we've talked about the exams and the requirements and the interviews. Simply the exams we've talked about. The requirements, you have to have a sponsor, you have to apply through الملحقية الثقافية. I had a different experience than Abdulaziz Alalshaikh, but Abdulaziz كان بعدي بسنة, so things may have changed then. Applications were totally for يعني through الملحقية. So now they may have made it two application process through الملحقية or through the school itself. Interviews are the same for every single specialty in every single country of the world. If you make it to the interview, in my personal point of view, if you make it to the interview, it means that you on paper were good enough to make it to the interview. And they're interviewing you to see how your personality is. They may give you a few situations. يعني أنا أذكر في الكارمز اللي هي الماتشنج process للستودنتس في emergency medicine في كندا. لما كانوا يجون عندنا, they would give them some situations where they would see how they would act. Typically, it would be an ethical situation. Typically, it would be a situation where they try to press you and see if you basically lose your patience, lose your professionalism. The one point other than the interviews that Ontario was different than some of the other places in Canada, but for emergency medicine, it's only McGill, is that we had to do a pre-entry assessment program required by the College of Physicians and Surgeons of Ontario. The College of Physicians and Surgeons of Ontario is the licensing body, and they require any school that accepts any medical student to do residency within Ontario to do a pre-entry assessment program. A short for it is PEAP, P-E-A-P. It's anywhere between 4 weeks and 12 weeks. This is زي ما قال Dr. Abdulaziz Almehilsi قبل, to make sure that you're not crazy, basically. That you maintain your professionalism, you come in on time, that you have a good interaction with the staff, good interaction with the patients, and that you have no major issues. And they want to make sure at the same time that you're someone who comes in and has a good personality, and at the same time you're teachable, you're trainable. We can actually take this person who knows nothing about emergency medicine or very little about emergency medicine and train them for 5 years and then make them experts on emergency medicine. We make them ready to pass the exam and be an excellent independent emergency physician. That's one thing to know about the application process في Ontario, which includes Ottawa, McMaster, and Hamilton. We already talked about the difference, and then I talked about my experience. Go ahead, Mohammed.
Yani Shabab made some excellent points. And I'm not going to go over the application process again, and just tell you about my experience. So if you notice that a lot of us, or most of us, are from Miguel. and that's not coincidental. This speaks to the fact that, you know, in Canada, the seats for foreign nationals, which, you know, non-IMGs, sponsored trainees, are completely independent from their residents, unlike the States. So they choose, you know, whether they're going to have these seats available or not. It's up to the program. So certain programs will say this year, like, we're not going to take any, and it's mostly these are agreements between pretty much Middle Eastern countries and Canada. I think now they also have some countries in South America as well. So they can choose to close it open year to year, which is why it's such a variation. Some programs for years have just basically said, no, we're not taking more people because they've had bad experiences or because they just don't see the need. Other programs more so see the need or see the benefit of it. Miguel being specific to that, it's very dependent on Saudi residents. That has to do with the fact that they don't have loan positions or consultants who graduate when we finish. We can't hire them. So we're a good deal for them. That's why they get a lot more. And we have
محمد, I think you're cutting off. ما ادري هو من عندي انا بس ولا الكل. اذا ممكن نواف ولا حنين تجاوبون.
ايوه فعلا.
اي قطع ترى. I think عندك مشكلة في الإرسال. I think so. I'm not sure. You're still cutting off.
Is this better?
Yeah, that's better. I think the mic also.
It's much better.
Yeah, sorry guys. I think my mic is not good. Yeah, I was just saying, you know, the big variation you see is because certain programs need people and certain programs don't need people as much, so they don't take foreign sponsored trainees especially from the Middle East. Miguel being one of the programs that needs them and has had a lot of experience with them and knows people well, so they're happy to take people year to year. Whereas other programs will never, don't take anyone at any point. And then you'll see the variation. Like if you go to UBC where I did my fellowship, I see a lot of people from Jamia Jeddah, etc., from the Western province, because they've had, good relationships with people who graduated there from the past. So they will more so take people from there. And certain, other universities will take more people from Kuwait or Qatar. فهذه كلها يعني لها تلعب يعني plays a big role. But the truth is, it's a lot less seats than the States, and it's variable year to year, and you have very little control of that. But at the same time, أتوقع إنه the relationships are closer with people who have worked there. So if you can speak to someone who knows someone, in a lot of programs, I've seen people who can pick up the phone and call someone over there in Canada and say, hey, I want you to take this person, and they can make that happen. Obviously, you have to be competent, but I think that's a big difference. And it's definitely all more streamlined than the States. There's one pathway and one way to do it. And just to comment about electives, and in my experience of seeing people doing electives, for the most part, the people I saw come to do electives from the Middle East, it worked out negatively for them. That's just in the two people that I saw do electives at the time I was doing my residency. So it's a dangerous thing to do if you're aiming for a place, an elective, because it's very difficult to be outstanding. And it's easy for them to say, hey, you don't know the system as well as our medical students, you're probably not as good. I think that's the only comments on to me.
يعطيك العافية دكتور محمد. Any questions about residency in Canada specifically before we move on? So I had one question. Was there a certain reason that I chose the Canada over the US? I'll be completely honest with you. يعني we at some point in time just think we want a residency abroad, and whichever comes, and that's it. طبعا that was my situation, and I think it will apply to anyone regardless of what we say. The reason why I chose Canada over the US was I had an acceptance in Canada, so there was no way I was going to say no. خلوني بالله سنتين اسوي اليو اس ماليز واقدم على امريكا، بعدين اذا قبلت في امريكا اقدر افاضل بين الاثنين وارد لكم خبر. It's not going to happen. If you get a residency position برا, you're going to take it on the spot. You're not going to think about it. The only time you're actually going to think about it is if you have more than one acceptance on the table. So it's not something you gamble with. It's not something that occurs easily. It's not something you want to gamble with. But in comparison to the US, the US has 3-year programs, 4-year programs, and Canada has 5-year programs. The difference between the 3 and 4 year programs in the US is that they basically make you do more shifts in a less amount of time. So if you do a 4-year residency, you do less number of shifts per month, but you have an extra year. Tamam. The same applies to Canada. You have more years, but you can do a fellowship within it. You can do a master's within it. You have tons of elective time. You're required by the Royal College of Physicians and Surgeons to do an area of concentration, or a mini fellowship, they call it. You have to do 3 months minimum in something in order to be eligible to sit for the exam. So you have to do 3 months minimum in anything. Anna, for example, I did 6 months in trauma. That counted as my special concentration. If I wanted to do a fellowship out of it, I could have made time with my electives and have taken up a full year in trauma, and I could have came out the 5-year residency with a fellowship in trauma. A good number of my colleagues did sports medicine, pediatrics, emergency medicine, and what was the ultrasound? So POCUS, so point of care ultrasound within the residency. So they graduated with these fellowships already. So this is the difference between Canada and the US in terms of length. And in terms of quality, I think, my personal opinion, again, the programs in the US are so many that I don't think you have the ability to control the quality in all of the programs. So only the bigger programs that have that started a long time ago and have a higher number of residents that went through are the ones that you can consider going to, such as GW, University of Maryland, I think Emory in Atlanta, and I'm not sure about the other ones, but Abdulaziz can give you a heads up on the names of those. Whereas in Canada, the number of schools is much less. The number of residents in a year is between 70 and 90, depending on how many people they accept. So you can imagine يعني 70 ل 90 resident هذا يوازي عدد الريزيدنتس في one big program in the US, وهذا عدد الريزيدنتس في 1 year في كندا. يعني ال R5s that sit for an exam are between 70 and 90. So it's easier to control a lesser number, basically. Any questions about Canada residency specifically? Is GPA important? Okay, that's answered. Yeah, I think the GPA is not a huge deal if you have a good MCC EE or QE1 score, and your CV generally is good enough for you to sit for an interview, and then your interview goes well, the GPA can be thrown out. Any other questions about residency in Canada before we move on to Dr. Fawaz and his answers about Australia? Going once, going twice. I think we can move on. So if we can move to Australia, Dr. Fawaz Altuwaijri did both his residency and fellowship in Australia, and he's one of the very few people who have done so in Saudi. He'll speak to you about the many differences in comparison to Saudi or US or Canada. Go ahead, Dr. Fawaz.
Assalamu alaikum jami'an. Thank you, Fahad. Thank you for everyone. Now, I'll just go through the questions again. The application process is very different. In short, there are kind of 2 parallel lines, not separate, but parallel lines. Your application for a position and your application for the training. The application is essentially you apply for a job in one of the accredited centers. You don't have to go through the embassy or the cultural mission or bureau. You kind of contact the directors or the hospitals directly. The other application process is your application to get accepted in the training. Now, very recently, which will start very recently change and which will commence in 2022, They've changed the application process and added a lot more requirements, unfortunately. Essentially, what you need is few exams and some time requirements, which is the very new requirement now. You have to have, in terms of exams, you have to have what they call a full registration to practice in Australia, which is essentially a time period of training, which has nothing to do with your training in emergency medicine. It's at least 3 months in a medical specialty, 3 months in a surgical specialty, and 3 months in a critical care medicine specialty. And then go through and then have the AMC, which is the Australian Medical Council exam, which is a bit of a hassle to get through, not in terms of difficulty, but in terms of timings of their exam. So essentially, at my time, the requirement the AMC exam is of 2 parts. Or the AMC certificates is of 2 parts. The AMC certificates, you need to pass the exam, and you need to have the time period, which I just mentioned. The AMC exam is of 2 parts again. It's a clinical knowledge, and it's an oral or a viva exam and an OSCE exam, which is AMC exam was an online exam. In my time, this was the only part required. But then during my training, they pushed everyone to complete their OSCE exam. The hassle that I mentioned was not really, again, the difficulty of the exam. The focus of that exam is essentially a general practice exam plus kind of 60% of general practice and 40% of emergency medicine, and nothing much else. So for someone who's already been through their training and through emergency medicine for 3 years and then go back and prepare for a general practice or GP or family medicine exam, well, was a bit of a hassle. Anyhow, so now they have this full registration. At my time, just to try and explain it, at my time there was what was called a specialist registration, which is a registration license or a license to practice only in the field that you registered or you're training in. But now they have the full registration as a requirement now. The other unfortunate, I was just looking at this yesterday. The other requirement, which maybe the biggest one now, is you have to apply for a position, for a training position. You have to be a PGY3 at least. Plus, you have to spend at least 6 months in a tertiary ED within Australia before and getting recommendation letters before applying, which is essentially a very long elective. It's not 1 month, it's 6 months of electives. What I don't have an answer to is whether you can start this elective or this is 6 months period and then go through your exam while doing the 6 months period. I'm not sure. This will buy you time, but if someone is really interested in going to Australia, they won't be able to enroll or to start their training until they're PGY3. The other thing that's not clear on the website yet is, in my time, I've already I've spent few years here. So they've accredited the training that I had here for the first stage of the training. So essentially, if you are an Australian graduate, you would go through 7 years of training. This includes, the first part is what they call 2 years of general RMO. This is not specific for emergency medicine training program. This is everyone goes through that. In other words, their internship is 3 years. You're an intern, but then you're an RMO, which is a resident, which stands for resident medical officer. You're a junior person within the team, but you rotate through through services or specialties. And then you have the provisional training, which is 1 year. So in my case, they've accredited the time that I've worked here, and it bought me time. Then you have the first, what they call provisional exam, which is the first part, which is equivalent to the USMLE Part 1, which is basic sciences, oral and, written or MCQ part and written, a Viva or an oral exam. And then you proceed to the advanced training. The difference now this is just answering the second question. The difference between the Australian training program and, in my opinion, the local and the North American exam is essentially you have a lot more flexibility in your exam and in your training. Just going back to what I tried to explain in the beginning, you're applying for a job, so you don't have to complete your training in one center or in one city. You have the choice to do your requirements in whatever number of centers, accredited centers you want. So, for example, you can spend a year in Sydney and then decide to move to Adelaide and then decide to go back to Melbourne, as long as your requirements are up to date and your centers are accredited for training. The other difference is the rotations. You have the core rotations, which are ED or emergency medicine and critical care services, either ICU or anesthesia. طبعا ED includes PEDS, ED, tertiary and non-tertiary settings or non-tertiary centers, and that's it. You have a year and a half of electives. Of course, there are a number of pre-approved electives. But if, for example, if you want to go and do an elective and trauma rotation elective in Johannesburg, which everyone does over there, you can do that. You can just write to the college and get an acceptance and so on. The flexibility is in two parts. Is in your electives, you have a year and a half, 18 months of electives, and you can move around Australia with no obligations to one center. I'm not sure if there are any questions. There are a few questions. Anyhow, how can you describe your experience in residency? Again, it was, if I had the choice to go back, I would choose Australia. But again, just to elaborate again, I agree with Fahad. Why did I choose Australia? Because I got accepted in Australia. That's it. If I had an acceptance in Canada or the States before, I won't waste time getting the requirements for any other place. I would just go with that. And that's it. Any other questions? GPA, no, that's still for McGill. Apparently no one is interested. I think no one heard anything after I said PGY 3.
And I think one of the major things that differ in Australia from North America and the Saudi program is that they call the schedule their roster.
They call it roster. I still refuse to call it schedule or rota.
So that's one of the big differences. If you want to start calling your schedule roster, then you should go to Australia.
If you want people to stare at you when you come back and join, when you say roster for 5 minutes.
So that's thank you very much, Dr. Fawaz. One important thing that I forgot to mention is the examination, and maybe Fawaz, you can tell us the examination process in Australia, but the examination process in the US. طبعا I did the American board and I did the Canadian board. The American board examination is 2 sessions. The first session is you sit for a 3-hour-long MCQ examination that's basically online, not online, but on a computer. And then this is typically around November. And then depending on where they put you, you can get you can get your oral exam either in end of April, beginning of May, or October of the following year, depending on where they place you. Because again, I've mentioned the number is so high that they can't do the examination of all residents who graduated from the program all at once. The oral exam is basically stations. They give you scenarios, you work through them, and then they grade you and you pass or fail. You don't enter this part of the exam unless you've passed the first part, which is the written exam. Previously, the American board, in order for you to maintain certified, you had to do lifelong learning assessments. You have to do 4 every 4, which is basically you sit through online tutorials and read articles and then answer questions on them. You have to do this 4 times every 5 years. And then at the end of the 10 years, you have to do an examination, which is kind of equivalent to your first written exam for the boards. They've changed this now where you have to do modules to maintain your certification, in addition to other small stuff such as basically teaching duties and quality improvement duties and so on and so forth. Now, the Canadian exam is a totally different ballgame. It's a 2 days of full written exam. So it's short and long answer examination. 2 days, 3 hours each day. And then 2 to 6 weeks later, you sit through an oral exam, which is 12 stations. And then same thing, they tell you afterwards whether you've passed or not. The difference between the Canadian exam and the US exam is that if you fail the written exam in the Canadian board examination, you don't know because they don't actually mark the papers until they all get together in Ottawa to do the oral exam. After they've finished the oral exams, they'll sit down and grade everything. So if you fail, you have to go through the process all over again. If you fail one component, you go through the process all over again. That's about the US and Canadian board exams. In terms of in-training examination, the American residency trainings sat through a what they call the American Board in-training exam. Similar to the board examination, you sit through MCQs every year, and then it goes, depending on what you score, it goes to your evaluation. In Canada, they have the Canadian in-training examination, which is a full day of written examination, short answer, which is simulates the board examination. And then in certain programs, you have to do the American Board in-training examination every year as well. And they take both these scores in comparison to your peers from the same year. And then it goes as a part of your evaluation at the end of each year to see whether you should be advanced, in addition to evaluations, obviously, from the shifts and rotations, to see whether you should advance to the next year or not. If you don't do big mistakes or have major issues clinically, then they won't hold you back. That's for the US in-training and board exams and the Canadian in-training and board exams. Fawaz, you can tell us your experience about the Australian board exam. I understand that the Australian board exam is much harder compared to the other ones.
Yeah, but it's known for being a challenging exam. Until this point, I really don't know. Well, I haven't been through a Canadian or American exam. Let's talk about the fellowship exam or board exam. It's a written and an OSCE part, 2 parts, written and an OSCE. And written is 2 3-hour sessions, an MCQ and a short answer question. You pass that, then you qualify for the OSCE. So you do know about your results, and you only know about pass and fail. The OSCE exam is a 3-day OSCE exam. The results will come out some 2 months later. That's for the fellowship exam or board exam or final exam. In training exams, you only have the provisional examination, which is the first part, or the USMLE 1 equivalent. which is again a written and an oral exam. They kind of make it a bit challenging to pass in by actually requiring you to pass all 4 subjects at once. If you fail one, but I think they've changed that. Don't. If you fail one subject, you have to go through them again. But I believe they've changed that. But they haven't changed it completely. So it's 4 subjects: physiology, anatomy, pharmacology, and pathology. You have 2 settings. Or 2 sittings to pass the exam. So, for example, if you passed 3 and failed 1, or you passed 2 and failed 1, you have to clear it in 2 sittings within 18 months or so. But this change, they've changed that in the past, and I think now they've gone back to a more flexible way of doing it. Is you have 18 months to clear it. It doesn't matter if you fail once or twice. As long as you clear it within 18 months, you pass. I mean, that's in addition to not examinations, but in addition to the other requirements, the research requirements and work-based assessment requirements, some skills or required clinical skills requirements.
واضح يعطيك ألف عافية. طيب, now we'll move on. If you have no questions about residencies altogether, we'll move on to talk about fellowships. طيب, seems that there are no questions except about the recording. حنين ونواف, واحد فيكم بعدين please tell the students on how to access the recording. If we start talking about fellowships in Canada first, starting with Dr. Badr Alyahya, because he just finished his shift and he has things to do. So please let him speak first, and then we can move on.
Thank you so much, Dr. Fahad. So if we want to talk about fellowships in Canada, I can speak to some, and then my colleagues can fill up the gaps. So at least in Ottawa, there is a chance of doing ultrasound fellowship, which is usually a 1-year fellowship where you get certificated in emergency ultrasound and in RDMS, which is basically you're an ultrasound technician, a certified ultrasound technician as well. In other fellowships include EMS fellowship. And in Ottawa, I think it's a great fellowship. I've been exposed to it during my rotations. They have an amazing EMS system. This EMS fellowship is available also in other universities, just like the ultrasound fellowship. It's available in McGill and many other Canadian universities. Other fellowships include ICU, of course, and toxicology. Toxicology is available in Canada. It's available at McGill, and I think in Toronto. I'm not sure if it's available somewhere else. These are the main. The toxicology fellowship is 2 years. The ICU fellowship is 2 years as well. The EMS is 1 year, and as I said, the ultrasound is usually 1 year. You can do a fellowship in epidemiology, and it's available in multiple universities again in Canada. You can do it as a master or as a fellowship, or you can do both together. You can do medical education. You can do medical education fellowship, or you can do medical education, a master of medical education, or you can do both again. I think that's it for me. If you have specific questions about the specific fellowships, then I'm happy to answer. I can talk about the toxicology fellowship because that's what I did. So it's basically clinical pharmacology and toxicology together. I said it's usually 2 years. You do clinical pharmacology and tox. You do poison center stuff and hospital toxicology, and you do rotations in different clinical practices to do your clinical pharmacology part. And at the end, you do a Royal College exam, just like the emergency medicine exam, but it's in clinical pharmacology and toxicology. And I will not talk about other fellowships. I will let my colleagues who did them talk about them. I forgot to talk about, I forget to mention the sport medicine one. So, and with that, I will finish here, and I'm happy to answer questions later on if you have any. Thanks, guys.
يعطيك الف عافيه دكتور بدر. I think we can move on to Dr. Abdulaziz Alshaikh with his experience in sports medicine fellowship at McGill, وبعدها دكتور محمد العقيل who did his ICU fellowship in Vancouver.
Yeah, so I'll talk about my experience with the ICU fellowship. So I just word of warning, I tell people when you're choosing, when you think about choosing a fellowship, whether you did a local program or your program, you know, your fellowship should be something you enjoy doing, but also when you reach that stage, it should be something that will probably serve you in your career in one way or the other. Either it's something you're passionate about or something that you can extend your career, as in extend this type of work you'll do, give you different paths and give you different options. Some fellowships are more useful for you, honestly, within the hospital. They give you more educational capacity. Some fellowships are definitely more research oriented. Some fellowships give you different, like with critical care, I can just become an intensivist and not do emergency medicine if I wanted to one day, for better or for worse. It's a mixed bag, and you're not going to be able to know what you like right now. I think for fellowships, you need to experience emergency medicine and then experience these fellowships through, like, or at least parts of these fellowships through your residency عشان يساعدك تسوي القرار هذا. Because في أشياء كثيرة تحس إنه this sounds really cool أنا الشيء هذا مرة بيعجبني. بعدين تجربه وتحس إنه no way I would never do this. Or you realize it when you ask about it, and it doesn't serve your career or what you want. الشيء اللي أنت تتخيل إنك you want right now is going to be very different 5-6 years down the line from now when you're at that point. We have to make these decisions. That's the thing to say. ICU in wherever you do it in Canada or in the US is considered like a very rigorous fellowship. It's very demanding. It's high stress. It's a lot of pathology, a lot of sick patients. There's a lot of mortality, so it's emotionally draining. And there's like a lot of ICU fellowships are abusive as far as their expectations of work, because you're expected to, most places you're expected to cover the unit and act as a consultant, but still be in-house most of the time. So it's a pretty painful 2 years. But I think you're a better physician for it at the end of it. And you become very comfortable with very sick patients, which is the reason I went into it. And it opens up a lot of extra work, which I think for me personally, I like having variational work. So I would recommend it to anyone. But you have to have understand these caveats.
Thank you very much. I believe Dr. Abdulaziz Almehilsi was a little bit busy. We can move on to the sports fellowship with Dr. Abdulaziz Alalshaikh. There's one question that was sent to me directly. I thought ICU was after internal medicine, not emergency. So ICU can be done after emergency medicine, after internal medicine, after neurology, after surgery, and in combination with any of the subspecialties of medicine, but most commonly it's done with pulmonology. The programs in the US have, and Dr. Abdulaziz Almehilsi will talk about this if he gets a chance to join us again, can be either, it's one of two pathways. It's either pulm critical care, so you get both specialties within 3 years, or it's anesthesia critical care, which is for graduates of the anesthesia program and emergency medicine. And then there's one third track where you do it on its own, and you can do it after neurology or after, if I'm not mistaken, even nephrology can do 1 year of critical care. So there are many options, and it's not specified to one specialty. You can do ICU from many different specialties. Go ahead, Dr. Abdulaziz.
Yeah, thank you. So again, I missed a big chunk. I had to leave for a couple of minutes, so I'm sorry. So if I'm repeating the others' talk, but concerning my fellowship, so why I chose sports medicine, for me, I think sports medicine for me give you any different aspects of emergency medicine. To give you the clinic aspect, more controlled flow, and I like MSK injury and sports in general. So giving these facts, I had the opportunity to do the sports medicine fellowship. It's a new fellowship. So basically I'm not a surgeon, right? So I don't deal with the ACL. I don't do surgeries. I don't treat any surgical complaint, but I do, as a part of a team, what we do usually is we make sure the recovery, the progression of the rehab treatment and the diagnosis are correct. And sometimes we deal with professional teams. So as an emergency, as a sports physician, you're gonna deal with a team covering all the players, including medical and MSK injuries. So basically that's with the fellowship. I don't, the true application in Saudi is still, so maybe in committees for the Saudi Federation, I'm involved, but clinically still, I'm looking for to open my clinic soon. So hopefully that's gonna come soon, but still clinically, I don't have any real applications. So I'm more than happy to answer any specific question about sports medicine in the if there's any.
Doctor,
يعطيك العافية.
received the question on WhatsApp. They are asking about the difference between the fellowships in sport medicine after ER and after family medicine.
It's almost the same fellowship. So basically, I was hand by hand with my fellow colleague. She was family medicine, so it's the same fellowship. Exactly.
What about the practice?
It's the same practice. It's the same practice. You do the same practice. It's the clinic practice, covering professional teams, depends, or becoming an administration for sports federations. So it's the same practice, same. They involve the same aspects, and it's the same exact fellowship. الفرق in emergency sports medicine is very few compared to family medicine positions. But that's the only difference, is the application of positions that's available.
Yeah, I had one of my colleagues in the same year who did a fellowship in her 4th year. So going back that you can do fellowships within your residency in Canada. She did sports medicine in her 4th year. It was the same program designed and actually monitored by the College of Family Physicians. It's a Canadian College of Family Physicians, CCFP they call it. And then she sat for the exam, which was done by the Canadian College of Family Physicians. Practice is the same for both emergency graduates and family medicine graduates who do sports medicine fellowships in Canada. Any other questions about sports medicine in Canada for Dr. Abdulaziz Alshaikh, or should we move on? It doesn't look like we have any more questions.
Especially that it's a new field in Saudi Arabia. Does it have, or how is the potential, the future of sports medicine in Saudi Arabia?
I think Abdulaziz is better suited to answer this question. Abdulaziz.
Yeah, the potential is very bright, right? So we're trying to have more federation in sports, more sports. Part of our 2030 vision is public participation in sport to be more than 20%. That's one of the Saudi vision, is we become more healthier, more sport friendly and sport participating population. So actually the future is very bright. So there is a lot of jobs that mainly administrative, not clinical, but there is a lot of new clinical jobs. So مثلا المستشفى الملك عبد العزيز الجامعي going to open a sports unit that's composed of orthopedic, maybe family physician and physiotherapist. So the future is bright. It's not there yet. It's a new fellowship, but I think it has a very bright future and very few who did it. So that's it. So we become an expert with like one of the few experts in the field, which is a good thing if you, I think, an advantage.
Excellent. Thank you very much, Dr. Abdulaziz. I'm not sure if Dr. Abdulaziz Almehilsi is back. I don't think he's back. We can move on to Dr. Fawaz, and he can talk about his fellowship in simulation in the University of Adelaide. Go ahead, Dr. Fawaz.
Thank you very much. Now I did health simulation in the Adelaide Skills Center, and it's part of the School of Medicine in the University of Adelaide. I agree with Dr. Mohammed Alaqeel in his definition of a fellowship. My own definition of the fellowship, being an emergency physician, is something that you enjoy doing, that's stress-free and opens up opportunities. It's not about avoiding stress. Our action and stress is fulfilled with your practice in emergency medicine. So I looked for something that is that's something that I enjoy doing, and that's stress-free, and essentially not a huge number of people have done the simulation or health simulation fellowship, and that's why I did this simulation fellowship in Adelaide. There are really good, well-known centers in Australia, apart from the University of Adelaide. There's the Monash Center in Gold Coast, and if you have the opportunity to do your fellowship in either, I can assure you you'll have at least 12 months of a very interesting and fun times over there. We in Saudi we have good centers, but we're still at the beginning. So I would still recommend, if someone is interested in health simulation, to do the simulation fellowship. I'm biased, but I recommend doing it in Australia.
Thank you very much, Dr. Fawaz. Do we have any questions about simulation in Australia? Before we move on, who do we have left? Dr. Abdulaziz Almehilsi. I'm not sure if he's back yet. Let me double check. Yeah, I think he got busy. He's working now, so I think he got busy. Okay, we can move on to my fellowship, and I'll speak to you. I'll speak to you about my experience. So I did an administration fellowship at GW. And during the fellowship, I did an MBA as well. This is just to echo on what Dr. Mohammed Alaqeel did. It's basically, I chose something. I wanted to do ICU, and then I decided later on in residency that I didn't want to do something that's as difficult, if not even more difficult, than emergency medicine. I wanted to do something that I liked, and I wanted to do something that I could fall back on later on when I'm tired of clinical work. So that's why I chose medical administration. Why I chose GW? Well, there are not many programs that give you the option of doing medical administration, especially after emergency medicine, that are designed specifically for emergency physicians. I can't recall any other programs except one, maybe in Philadelphia. And it wasn't as flexible as the one at GW. So the reason why I chose GW is, one, limitation of choices to begin with, and two, the flexibility they had with the fellowship itself. They actually recommend and push you to do either an MBA or an MPH to make the most value of your fellowship, because you're learning things theoretically and doing things clinically and non-clinically at the hospital, which you can see from what you learn in your master's degree. It's a 2-year fellowship. The fellowship on its own doesn't have a lot of work to do with it. So this is why they push to do a master's with it. And this is why it's so flexible around the master's as well. Just an FYI, if you choose to do this fellowship, it's a good fellowship. And it does have some work. It's just the amount of work is perceptively different from one person to another. I didn't see the fellowship as busy on its own, but when combined with the master's, it was extremely, extremely busy, especially that you're required to do a certain number of shifts every month. My situation was a little different than those who are, let's say, not allowed to work in the US. I won't get into the details, but I have a US citizenship, which made my situation a little bit tricky. So I had to work as an attending with them in order to get into the fellowship. So I had to do 8 shifts per month. I was involved in 4 to 5 committees across set number of hospitals. I had at least a semi-weekly meeting with the program director to discuss chapters of different books that he saw were extremely important. And this guy who's the director of the fellowship is also the chairman of the GW Emergency Medicine Department and has been for over 25 years. So he has a lot of experience under his belt. And then add to this a full-time MBA, which is a part-time MBA, but you have to do it within full-time hours. So it has to be 9 credit hours per semester. And one of the semesters comes out to be 10 hours. So you can imagine the workload that you have throughout the year. And this is including summer sessions as well. So it's you don't have the summer off. I think I would, if I went back, I would do the exact same thing again. I enjoyed the experience. It opens up your eyes to a lot of things that you may not necessarily be normally exposed to if you're not involved within the administration of the hospitals, especially that I dealt with 2 different types of hospitals. So I had the government funded public hospital. I had the privately owned corporate hospital, which was a for-profit. And then I had the experience of working in a government-funded hospital for basically a set of the population, which was the VA, the Veterans Affairs hospitals. So I got the privilege of working with 3 different types of hospitals and being involved with different committees within them. And it was an enriching process, to be honest. And I'm not aware of any other fellowship or an official administration fellowship in Canada or in the US other than the one in Philadelphia. That's my experience. Generally speaking about fellowships, we've narrowed it down to speaking about our experiences for people who graduated from the same country and going to fellowship within the same country and sometimes within even the same program, meaning the same university. But you have to know that there are different requirements and different application processes. If you're doing a fellowship after you do residency for Saudiya, that depends on which specialty you want, where you want it, and then if there's an examination required after it or not, and if you're not, and whether you're eligible to sit for the exam or not. An example is if you do emergency medicine for Saudiya and then you go abroad to do ICU, let's say. So if you want to do a critical care fellowship, you may not necessarily be eligible to sit for the exam. I think that's changed in Canada now. You're eligible to sit for the exam. And then you have to know من الهيئة السعودية للتخصصات الصحية that if you do a fellowship abroad and then you come back without an exam, does it actually count? Because if they have an exam for it, في الهيئة السعودية للتخصصات الصحية, because they have the fellowship في السعودية, then you have to sit for this exam. So just things to keep in mind. I hope that point was clear. Other fellowships you can do that weren't mentioned, and maybe Dr. Abdulaziz didn't have the chance to come back. Ultrasound is one of the excellent fellowships. You learn a lot about ultrasound during any EM program you join. So point of care ultrasound, specific things, you expand on these things when you actually do a fellowship. So you get to practice more and then learn new additional things to do within the fellowship. And then you have the chance of being an RDMS and RDMS and RDCS. So registered diagnostic medical sonographer and registered diagnostic cardiographic sonographer. I'm not sure. Yeah, RDMS and RDCS. So you basically have to do a set number of ultrasounds and do, I think, a project within the fellowship. Typically, the fellowship is for 1 year. And then you sit for an examination, and then you get for the RDMS and for the RDCS. So it gives you certifications, which are basically equivalent to the board when doing an ultrasound fellowship. It depends on where you apply in terms of the difficulty of being accepted. I'll give you an example. For McMaster, when I was doing my residency, I wanted to do ultrasound within my residency instead of doing trauma as the mini specialty. I wasn't able to because the program was small. The instructors were few, so we only had 2 or 3 instructors that actually did fellowships in ultrasound that were involved with the program, and they could only accommodate 2 per year. And they chose the 2 that were going to stay within McMaster University because they wanted people to help develop the program. And they told me, frankly, we won't take you since we have 2 other applicants, because we know that you're going to pack your bags and go back to Saudi once you're done with the program. Whereas these 2 folks are going to stay and help us out with the program. And we want to expand the program so we can have more sites and expand the number of fellows that we can take per year. And that's what happened. So they have 2 per year almost now. And this is since 2015. And you can do the math on if at least 50% of those stayed, then that's the number they had. Dr. Mohammed يقول, if you don't do your residency training, yes. So there are also things about when working independently. So if I did my residency in Canada, and I did my fellowship in Canada, then I can find ways where I can get not find ways, you can actually get an independent license to work as a independent practitioner in the same specialty that you've been, you got the board in. So let's say I finished emergency medicine, I passed the Royal College exam in emergency medicine, I'm allowed to apply for the independent license from the licensing body. So in Ontario, it's the College of Physicians and Surgeons of Ontario. And I can practice part-time as an emergency physician while doing my fellowship. Same applies to internal medicine. While doing their fellowships, they can work as general medicine practitioners until they finish their fellowships, so on and so forth. This has to be after you do your boards. The same applies in the US. But it's a little bit trickier in the US because you can't work as an independent practitioner unless you have a working visa or you're a US national. So if you're a US national, you have a social security number, you can work. If not, then they have to get you a visa, which is a little bit trickier when doing a fellowship. So typically you can't do it if you're doing a fellowship because it means you have to leave the country for a year and then, or 2 years and then come back later on. I don't understand the details of that, to be honest. Abdulaziz would have been great to talk about that. What else should we talk about in terms of fellowships? Other available fellowships include pediatric emergency medicine. We talked about medical education, simulation. We talked about toxicology, sports medicine, administration, ICU. The other fellowships that you can do are emergency medical services, so EMS. The available fellowship in Canada that I know of is in Toronto and in Hamilton and McMaster. And then we have disaster medicine, which has many centers that actually provide that fellowship. Soon we'll have 2 fellows joining the disaster medicine fellowship في جامعة الملك سعود as well عندنا في القسم. So we have many options with that, which is good. This is the benefit of having people who actually get trained in certain specialties, because then you can actually train others within your own country to become experts such as yourself. And then what else am I missing in terms of potential fellows? Pediatrics emergency medicine. Pediatrics emergency medicine, you can do pediatrics residency and then pediatrics emergency medicine. And you can do emergency medicine and then do pediatrics emergency medicine fellowship. I was hoping to get to Dr. Anas Athniyan today, who did, he's one of the very few people who actually did an emergency medicine residency followed by an pediatrics emergency medicine fellowship abroad. He did his residency in McMaster and then his fellowship in pediatrics emergency medicine at University of Western Ontario in London, Ontario, but he wasn't able to join us. He's making use of the international flights now, and he's on vacation, so we weren't able to get him to join us. Any questions about residency, fellowships, general questions not specific to location? We'll be able to take these now. Dr. Fawaz had something come up. He had to leave. Dr. Badr, I told you earlier, had to leave. So it's me, Dr. Abdulaziz Alshaikh, and I think Dr. Mohammed Alaqeel is still here. Yes, Dr. Mohammed Alaqeel is still here.
Doctor, there are lots of physicians who say that if you decide to have a fellowship in a field that is not purely clinical, it might affect your clinical touch. How can you balance and keep up your experience and exposure while doing fellowships?
So I agree with the statement. You can feel yourself when you're away from a certain specialty for a bit, that you feel that you're a little bit rusty when you start over again. The way I suggest you do it is that if you have the chance to work while doing your fellowship, do it. So I had the privilege of doing this. I'm pretty sure Abdulaziz Almehilsi did not because of the visa issues, but he was doing critical care, so it's relatively close to emergency medicine. He deals with the patient throughout the way instead of just when they first come into the emergency department. Dr. Mohammed Alaqeel was able to do to work in emergency medicine while doing his ICU fellowship. The same applies to Dr. Fawaz Altuwaijri. I think he was able to work in emergency medicine while doing his fellowship. Dr. Badr Alyahya was able to do emergency medicine while doing his toxicology fellowship. I think if you have the chance to work as an independent practitioner, go ahead and do it. If you don't, then you should go and actually basically observe in the emergency department, see how others practice. Just refresh yourself every once in a while. So let's say that you finished residency in Saudi Arabia, you went to do toxicology في Emory. Toxicology in Emory is a postdoctoral fellowship. So you don't actually see, it's not a hands-on patients thing. You just do basically poison control work, which is what you need for the toxicology fellowship. But you don't see the patients hands-on, صح? So you're spending a year or two without seeing patients. If you don't take a part of your free time and go visit the emergency department, you may lose, it's not necessarily a fact, but you may lose your touch in emergency medicine, at least for the first bit when you come back. Another fellowship that I forgot to mention is trauma. Trauma fellowship is something that I know is available in multiple places, but it's specifically for the trauma surgeons, except for in Hamilton, where it's the other way around. You do more medical stuff and management and organization between the services rather than doing the surgeries. Any other questions? If I do my residency in Saudi Arabia, how are my chances of acceptance and fellowships abroad, and how can I increase it? It depends on what the fellowship is and how available the fellowship is. It depends on how many programs there are in the fellowship itself is, and how basically foreign fellows or residents friendly they are. So it has many factors that play into it, but I don't recall anyone who actually worked hard to get a fellowship abroad that wanted to and didn't get it. So it depends on what you want, where you want it. That has many factors into it. And if any of my colleagues have anything to add to that, please go ahead.
No, but I agree, and it's a dynamic process. So in 4 years' time, it's made different from today's time. So all these are dynamic. So sometimes you'll have Now it's a good time to do fellowship. So if you're interested in fellowship, it's a good time. There's a lot of, and especially in Canada, there's a lot of sponsored fellowships available, so on in Ottawa, so on in McGill. It's a good time to do a fellowship. How to increase your chances? That I actually don't know how the answer to, but I think same is applied to the residency. So it's a good CV, good public, and proven effect that during residency you did a good job. You're involved in the residency program. You were active in research. All these will increase your chances in getting accepted to fellowships. You may be limited if you want to do clinical fellowships. So that's going to be maybe difficult a little bit, especially in the US.
Excellent. Thank you very much. The only sponsor is the government. That's a question. So I'm not sure about the private hospitals, to be honest. Again, the things are changing. So that may change. يعني بكرة ممكن الحبيب يبتعث ناس، ممكن المستشفيات الثانية تبتعث ناس. I don't know if they're doing that now in terms of fellowships. As far as I know, for the time being, yes, it's only the government hospitals that are sponsoring fellows.
I'll just take it like one step forward. Like, let's say, Nick, you don't find a sponsor and you're going to say, I'm going to pay for myself. You can't do that. It has to be an institution that's sponsored.
Yep. Any other questions?
There's a question I received in the chat privately. What are the fellowships available locally?
That's a tough question. I honestly don't know. I know that we have pediatrics emergency medicine. That's for sure. It's available in multiple places, and I think it's been a well-formed fellowship for many years. So they have a detailed program. They have 2 years of rotations, and then you sit for a board exam, and you can enter it through pediatrics or through emergency medicine. The other fellowship that I know about that's coming up is the disaster fellowship عندنا, which actually started getting applicants now. I know that there are other fellowships in the works, but I'm not sure if there are other programs ولا لا. بس عندنا في الجامعة بنفتح at some point in the near future an ultrasound fellowship and a toxicology fellowship, if I'm not mistaken. So both of them. The poison center في وزارة الصحة is doing huge work. بقيادة الدكتور بدر اليحيى. They're doing excellent work. They receive calls from all over the country. So they're taking care of all of the poison related calls from all hospitals and directly from patients from all over the country. So they have a lot of data that I think they can use towards using for a fellowship, basically. And then I think they're going to start في الملك خالد الجامعي soon. Another question. Is the only sponsor is the government? Yes, from what I know, the only sponsors are government hospitals. No, they're not international sponsors for us. Do I need to take a rotation in the same country that I want to take my fellowship during my residency? طبعا, do you need to? No, absolutely not. But is it something that may increase your chances? Yes. يعني it depends on how you do in your elective rotation في specialty that you want to apply to. I'll give you an example. I wanted to do ICU. I made sure to get in contact with the ICU program director. I told him I wanted to do ICU, and I wanted to do it as an overlap program. So I think this is something that stopped now. But during R4 or R5, instead of doing 5 years of emergency medicine plus 2 years of ICU, you do both within 6 years. They just take away a lot of your elective time during the 4th or 5th year, depending on where your residency program is. And then you sit for the ICU exam a year after your emergency medicine exam. The thing that I did was I talked to him. I did an elective rotation with him. And then basically what he told me was, I'd rather, if I'm going to take an externally funded fellow, I'd rather this fellow be already aware of the system. So he knows Hamilton, he knows McMaster, he knows the hospitals that are affiliated with McMaster, and he can work in any of these ICUs. So I won't take the risk of taking someone who comes from Saudi, ولا الكويت ولا البحرين ولا عمان ولا whatever the case may be. I'd rather take someone who already knows the system and I've seen their work in front of me. So it depends on what the fellowship is, who the program director is, and what the situation is exactly. And if a lot of variables, unfortunately, in these things that can change at any point in time. Any other questions? Any other questions? طيب, I think we've done more than enough on this subject. If you have any questions, you can send them to Nawaf or Haneen, and they can forward it to me. I'll be more than happy to answer. If you want, you can send it to my email, موجود مع حنين ونواف. Thank you very much for your time. Thank you very much for all of my colleagues. كل واحد باسمه. I hope this was informative. I think the bottom line is make your decision early, work on your decision early, and then do the requirements earlier on, but prepare yourself well, and then set yourself with a timeline. يعني أنا أعطيكم example سريع. I did the MCCEE because it was one requirement for Canada, and I already applied for a master's in Australia, and I got accepted, and it was an MPH, and the plan was, if I don't get accepted in Canada that year, I would go to Australia, do an MPH, and do the USMLEs at the same time, get them out of the way, and keep applying to Canada, and then to the US once I'm done with the USMLEs. And during that time, I would finish my master's, and I gave myself the time limit of, if I'm done with my master's, which was 2 years long, and I don't have an acceptance, then I would try my best to get into the Saudi board program, which is even tougher to get into nowadays. And that was it, خلاص, done. But you have to set yourself up with a timeline and stick to it, not to waste many years of your life in the gray area of not having done anything. يعطيكم العافية جميعا. We'll see you next time when we talk about, I'll leave it as a surprise, I guess. خلي نواف وحنين يتكلمون عنها بعدين.